Today we are diving into how to monitor your blood pressure accurately at home. This video is intended for medical professionals and the general audience. Let's get started. There are three key ingredients to ensure accurate blood pressure measurements at home: choosing the right time, mastering the right technique, and using the right device. So, is there a perfect time to check your blood pressure at home? The answer is yes and no. While you can measure your blood pressure at various times throughout the day, which I highly recommend to my patients, it's important to avoid certain activities right before you check your blood pressure. According to the American College of Cardiology and the American Heart Association, for the most accurate readings, steer clear of caffeine, alcohol, exercise, and smoking for at least 30 minutes before you take your blood pressure measurements. And do not forget, sit quietly without speaking for about 5 minutes with your feet flat on the floor and your back supported, and ensure your bladder is empty as well. These simple steps help eliminate factors that can falsely raise your blood pressure. What's the right technique to check your blood pressure? When it comes to accuracy, upper arm monitors are the way to go. The American Heart Association recommends using an arm cuff-based devices over a wrist monitor because they tend to be more reliable. Studies have shown that measurements from arm devices align much more closely with what we call ambulatory blood pressure monitoring, which is the gold standard for assessing blood pressure for accurate blood pressure measurement. For accurate blood pressure measurements with an arm cuff, be sure to keep your arm at heart level. This applies whether you are using an arm or wrist monitor. The American College of Cardiology and the American Heart Association recommend measuring blood pressure in both arms at the first visit or at the first time. The arm with the higher readings should be used for subsequent measurements. And to ensure accurate readings with an upper arm blood pressure monitors, it's essential to choose the right cuff size. Blood pressure cuffs are categorized into small adult cuff, large adult cuff, and adult thigh cuff. Now, based on your mid-arm circumference, the American Heart Association offers the following guidelines. Use a small adult cuff if the mid-arm circumference is 22 to 26 centimeters, and use an adult cuff if the mid-arm circumference is 27 to 34 centimeters. Use a large adult cuff if the mid-arm circumference is 35 to 44 centimeters. And we use the adult thigh cuff if the mid-arm circumference is 45 to 52 centimeters. Using the wrong cuff size can lead to major inaccuracies. A cuff that is too small may produce falsely high reading, while one that's too large can result in readings that are too low. For the most accurate blood pressure readings as well, use a cuff with an inflatable bladder that spans roughly 80% of the patient's arm circumference. And for those who may not know what the cuff bladder is, it is the inflatable chamber inside a blood pressure cuff that, when filled with air, compresses the arm's artery to allow for an accurate blood pressure measurement. Now, what blood pressure device should I get? The American College of Cardiology and the American Heart Association recommend the following automated, validated monitors for home use for blood pressure. And again, I have no financial ties to the manufacturers of these machines. Omron 10 series BP-7450, or Omron Platinum BP-5450, and the Omron M6 Comfort and Withings BP-800. These models have proven to be accurate and user-friendly for home blood pressure monitoring. Just remember, even the best device will not deliver accurate results unless you follow the proper measurements, procedures, and techniques. In the end, if you found this video useful, please give it a like, share it with your colleagues, and subscribe to the channel if you have not done so. And if you would like to receive a summary of this video and more health-related tips, kindly subscribe to my Substack. The link is provided below. Thanks for watching and see you soon.